We want to start this video paying tribute to our dear friend and colleague Sadiq Patel, who was with us for 10 years, and unfortunately we lost him about 2 years ago. He was instrumental in all the work that's going on now and that has gone on. He was one of the pioneers of the call for a kit, and he is greatly missed. So this video and this work is dedicated to Sadiq Patel. I just wanted to start by saying the bowel cancer health promotion team have been tirelessly working for the last 15 years to promote bowel cancer screening within their local communities. There are two work streams: the Call for a Kit project and targeted community interventions across the whole of Lancashire. Call for a Kit started in 2015 as a pilot with 2 or 3 GPs in Blackburn. We had the challenge of showing evidence of outcomes to local communities. So one of the approaches that we thought of was Call for a Kit. And in a nutshell, Call for a Kit is engaging with non-responders, inviting them to a clinic, seeing them on a one-to-one, face-to-face appointment, and eradicating any barriers or worries or concerns that they have. The Call for a Kit pilot lasted for about 2.5 years, in which the team saw 10,000 or engaged with 10,000 non-responders, and we had an uptake of kits which was around 47 to 54% in that pilot. After that, the team sort of grew from 2 people. We commissioned the service to Community Voluntary Services in Blackburn.
So from a team of 2 people who it's taken to start the project, we are now a team of 8 people, and it's been fantastic. We've got 7 health promotion officers that work across Lancashire. We do tend to, the project will focus on trying to adopt a face-to-face clinic where possible. And the only reason for this is, over the years, once we've done the analysis on our figures, it has been proven that the uptake is a lot more higher than once somebody has attended a face-to-face clinic as opposed to having a telephone consultation.
CVS is well placed to provide the support because we are part of and understand the communities we serve. We are very flexible and passionate about tackling health inequalities, and we have great connections with community groups and can reach those parts of the communities that traditional health promotion approaches don't reach. Our approach is successful because of 3 things. Firstly, we put people at ease and engage in conversations that don't use technical language and jargon, so that they can really understand what it is we're asking them to do. Secondly, we give them time and support to think things through. And thirdly, we help them to ask any questions they've got and practically know all the next steps that we require from them.
The Call for a Kit clinic is more than just a process, it's a partnership. It's communities working together to make health a priority, and every completed kit is a step towards early detection, better outcomes and healthier lives.
Now, living and working in Burnley for over 20 years, I know that language can be a real barrier, but we're really fortunate to have some team members from diverse ethnic backgrounds who can speak different languages, and what we found is that speaking to somebody in your own language has made a massive difference in helping those patients understand and complete those kits. Now, this personalised and supportive approach has significantly increased the screening uptake in our surgery, and we're incredibly grateful to our wonderful team to help in making it happen. I believe that this model is really effective and it can save lives through earlier detection.
As a practice, we tend to focus on dealing with acute problems, dealing with problems which are there and then. This project works to try and look at prevention, and by looking at prevention, this is something that is important as a GP, but it often falls low on our list of things to do. We're great that the team is coming in, the team are working with our patients, and they are working to increase our numbers. We've tried this in the past and it often doesn't work because we have other priorities. People are coming into our surgery, so they're coming to somewhere they know. The family don't need to know that they're coming to see someone who's to do with bowel screening. It could be anything. So it's a local building with local doctors who they know, also local people working with them, and that gives them great trust, and that will reinforce the fact that they will come for the bowel screening and send off their kits.
It's working brilliant. I wouldn't be in the position I am right now if it wasn't for the project. And it's just making us, because we've started this journey, we're continuing with this journey, and we want to do this across the board on other cancer checks. So yes, I want to carry on with this project. It's been an amazing journey.
My name's Alf Clemson. I'm the County Councillor for Poulton Loughfield, and this year I'm the Chairman of Lancashire County Council.
And have you heard about bowel cancer screening?
Yes, I have. I think I got it through my local GP first, and a couple of years ago I think I got a pack through the post, and I returned that, and then I've just done one in the last sort of 6 weeks, and I returned that, and I got the word back that it was okay, and I could go on for I would get another one in
2 years' time.
2 years' time there. Yeah.
Okay.
So yeah, all good. So I'm clear at the moment. All good. I would say it's not the getting something through the post and having to put a sample in it and send it away. You could forget about it. You could say, "Oh, it doesn't apply to me." But now that I've done it, I'm happy because it came back. You're clear at least for the next couple of years. So I'm quite happy that they've told me I'm clear and it's done. So good news.
Screening test on 16 January, received the test, it came back saying it wasn't normal, so I needed to see somebody with regard to bowel screening and a colonoscopy. Yeah. 7 polyps I had removed, so, and all, at the time I was actually told that they were all benign.
Had I not done that test, I don't think I would be talking to you now. I'd either be very, very ill or not even here. If people are scared, they've got to look at the future and then think how lucky I was that I did it.
Diagnosed the issue so early on, the fact that it was dealt with very quickly and to effectively, it was quite straightforward, I believe, from a surgery perspective. If you don't take the screening test and you only find out through the symptoms, which are very, very normal symptoms, you don't realise it until it's almost really severe. The impact then is far more severe, not just in yourself from a health perspective and from a recovery perspective, but also the cost of the NHS of having to go through all the tests to determine what the actual issue is.
Kit is a very highly acceptable intervention. We have seen that majority of people who get the call for a kit phone call accept to attend the call for a kit clinics in primary care, and majority of people who attend the clinics, about 97% orders a test kit. Of the people who attend the clinic and request a test kit, about 40% returns their test kit. And when we look at the overall population who are targeted for call for a kit, we have identified that call for a kit improves screening uptake by 14%. Any health promotion work is important to understand whether we are helping reducing health inequalities. By health inequalities, we mean, for instance, what people experience because they have food poverty or they have deprivation and they have low access to certain aspects of healthcare, they have inequalities relating to accessing transport and other elements. And by delivering equitable care, by providing people opportunity and access through new modes of delivery, providing relevant information that helps them understand things, breaking barriers, then we will be able to address inequalities. And evaluation helps us understand whether what we deliver provides that.
Ministers in 2018 decided that bowel screening should be offered to all people from the age of 50. NHS England began the age expansion in April 2021, and this was completed by 2025. Evidence has shown that since sending screening kits out to individuals between the ages of 50 up to 59, the uptake has been less than 60%. As a service, we've wanted to be able to address this. We acknowledge that most people between the ages of 50 and 60 are of a working age. We have adapted our way of working. I started a pilot in June 2025. I work with 2 GP practices in the South Cumbria area. With agreement from themselves, I work remotely. I offer video clinics to individuals between the ages of 50 up to 60 in an evening. I send them out a text message stating that I'm sending it from their practice. They open that text message, allowing the camera and microphone, and that brings them into a meeting with me where I'm able to explain about the bowel screening programme, show them the kit, how to use the kit, and answer any questions that they may have.
So the Call for a Kit clinic gives the opportunity to have that conversation and to help explore what the barriers are, and then it's an opportunity to say, well, actually, let's have a chat about that. What can we do to kind of, work together to get you, through the screening programme? And I think it's just that conversation can make all the difference. I think particularly in the younger age group that are being invited, people don't think the kit is for them. They think they've been posted it by mistake, that they're too young to be invited to take part in a bowel cancer screening programme. I think that's one reason. I think people of the working age are incredibly busy. They have families and they've got children to look after, so they're having to prioritise juggling all these plates, and having that one extra thing to do might not be seen as a priority, particularly if they think they're too young to take part in the programme. In South Cumbria are successful and are important. The early initial data is showing that it's having an impact. And some of the anecdotal evidence that I've been made aware of is that one gentleman, for example, has said that if he got the kit and not had the Call for a Kit experience, then he wouldn't have taken part. And for me, that in itself, speaks volumes. So, yeah, really, really important and valuable work.
The Call for a Kit clinics give the patients a face to the name. And for some patients, this is helpful when discussing sensitive topics like this. Lorraine was very flexible and accommodating to patients, offering telephone calls when patients couldn't use video calls, and this the patients felt was very helpful and made the process of offering support streamlined and easy. It helped with our surgery, especially as the states can sometimes be a challenge.
So Call for a Kit is a model. It's a great intervention that we have. It's recognised as being really successful, in the local area and also nationally in increasing participation in bowel cancer screening. So the difference it makes has been recognised. As well, bowel cancer screening is constantly evolving, with younger people now being invited routinely, So I know the team are now looking at if the model still fits for younger cohort and trialling different approaches such as community clinics, different types of clinics, and exploring the use of technology to support this. Yeah, health promotion is really key to us improving uptake and the success of the screening programme. So it's really important to ensure that there's information out there and that conversations are normalised, but also interventions with people who we know have not taken part in the programme to give that support as well, and an opportunity to talk to someone about bowel cancer screening, ask those questions and understand the process. Because there's a range of reasons why someone may not take part, at individual level as well. Often some of the feedback that the team get around people say that they're just too busy or they've just not done it. Bowel cancer screening is very much a home screening, so often no one's probably asking an individual if they've taken part or not, particularly in terms of a healthcare professional. And so it can be easy to ignore for some people. Also, some people, I think there's a feeling of that they don't need it, they don't feel they've got symptoms of bowel cancer, so it's not relevant for them. But of course, the importance is the whole aim of the screening programme is to detect cancer or precancerous conditions before symptoms develop, when treatment will be more effective.